Bismillahirrahmanirrahim. In continuation with the inherited liver disorder, this is the last one. This is the primary biliary cirrhosis or the biliary cirrhosis. The biliary cirrhosis simply applies to a condition in which there is excessive accumulation of the bile, and that is because of the autoimmune destruction of the intrahepatic biliary ductules and ducts, which lead to the obstruction, and so you may see the features of the cholestasis. We also discuss this condition in case of cholestasis. So the biliary cirrhosis is divided into primary biliary cirrhosis and the secondary biliary cirrhosis. The primary biliary cirrhosis, as the name implies, is because of some sort of autoimmune disorder. This is mostly seen in the middle-aged women, in which there is autoimmune destruction of the small biliary duct. The primary biliary cirrhosis is characterized by chronic, progressive, often fatal cholestatic liver disease, and the pathogenesis involve the autoimmune disorder, aberrant expression of the major histocompatibility 2 molecules on the bile duct epithelial cells, which leads to accumulation of autoreactive clones of T cells, and this is in fact the T cell mediated injury to these cells, which lead to the destruction, and destruction is in the form of the non-caseating granulomas, where there is mononuclear infiltrate, eosinophils, and non-caseating granulomas, along with the bile duct proliferation and duct and destructions. Normally, the bile duct proliferation is seen in the ducts which are lying before those ducts which have been involved by this process. Here in this micrograph, you can see the excessive accumulation of the lymphocytes or the mononuclear cells around the bile ductule, which are in fact forming a sort of granuloma. The lab diagnosis depends upon finding the number of the antibodies. Among them, on top is the anti-mitochondrial antibodies, which are found in 90% of these cases. Serum antinuclear antibodies found in 50% of the cases. There is increased level of the serum immunoglobulins of IgM class, increased serum alkaline phosphatase, and GGT. You know, as increased serum cholesterol. This is because these two findings are because of the cholestasis intrahepatic. Finally, the clinical features: the predominantly a disease of the woman. The female to male ratio is 6 to 1. 20 to 80 years is the peak, is the age involved. The peak age is normally 40 to 50 years. The feature would be pruritus, jaundice, xanthomas, and then thalassemia, and that these are because of the cholestasis which is there, and we have already discussed the cholestasis. No, it is only insidious. It is clinical presentation. It is insidious in onset: pruritus, fatigue, abdominal discomfort, xanthomas, xanthelasmas, steatoria, and finally features of cirrhosis. The most earliest feature normally in this case is the pruritus, which is because of the accumulation of the bile salts in the body, and the xanthomas and xanthelasmas they present first. Then there is steatoria, which is because of the improper absorption, improper digestion, in fact, of the fats, and finally the feature of cirrhosis because of these restrictions and degeneration. So this lead to primary biliary. Secondary biliary cirrhosis, this results from the prolonged stasis of the bile, back pressure, regurgitation of the bile duct changes, and inflammatory response. But remember that in the secondary biliary cirrhosis, there would be feature of the obstruction along with no anti-mitochondrial antibodies and no granulomatous destruction of the bile ducts. This is because of the blockade, and blockade results in the damage of the bile ducts, and also the scene is the bile duct